According to 2023 data from the CDC, 1 in 36 children in the United States is identified with autism spectrum disorder. When many people hear that statistic, they picture a very specific, stereotyped presentation of autism, often influenced by characters in movies or television. That narrow public perception creates a massive blind spot for parents and educators attempting to support their students. Because of that blind spot, certain demographic groups routinely fall through the cracks. Girls, as well as Black and Latino children, are consistently misidentified or diagnosed years later than their peers. The root of this diagnostic delay is access. Traditional community care settings often lack the specialized resources, the localized education, and crucially, the culturally competent clinical teams necessary to identify atypical presentations of autism. For the K-12 school system, the downstream effects are immediate. Neurodivergent students navigating the classroom without accurate support experience spiking levels of anxiety and a sharp rise in chronic absenteeism. The resulting mental health crisis in our schools stems directly from this structural failure to actually see and support the diverse realities of the student body. To understand those diverse realities, we have to look past the stereotypes and break down the clinical definition of autism spectrum disorder into its two core feature sets. This logic model maps the first set, persistent differences in social communication, including challenges with reciprocal conversation or reading nonverbal cues. The second set focuses on restricted, repetitive behaviors, representing intense sensory sensitivities or focused interests. But autism is a spectrum. No two students present identically. Addressing that level of individual variation requires a layered care ecosystem. A student might need speech therapy, occupational therapy for sensory management, and psychotherapy for anxiety or trauma. Because identifying and supporting this condition is highly individualized and requires licensed clinical identification, the standard model of relying solely on a single school counselor is physically unequipped to handle the load. For Georgia's K-12 administrators, attempting to clinical ecosystem inside a school building is an overwhelming logistical hurdle. This gap in resources is exactly what MentalSpace School was designed to fill. It operates as a dedicated teletherapy infrastructure built specifically to integrate with K-12 schools. To address the demographic blind spots we looked at earlier, their model deploys distinct teams of licensed, culturally competent therapists. These teams are trained to recognize the atypical presentations of autism that frequently get overlooked in girls and minority children. The platform operates with tight operational speed. Schools get access to same-day teletherapy, a dedicated therapist team assigned specifically to their campus, and embedded crisis intervention capabilities. By deploying specialized teletherapy directly inside the school environment, students bypass the months-long waiting lists at traditional community clinics. For administrators, there's also a ticking clock. Georgia's House Bill 268 mandates strict new school wellness requirements, with a hard deadline of July 2026. Schools now face a clear institutional choice: execute the bare minimum to pass a state compliance audit, or build out an infrastructure that actually provides complex, reliable care to their students. Structuring that higher level of care requires sustainable financial logistics. MentalSpace handles this by accepting broad commercial insurance and, crucially, offering care at zero out-of-pocket cost for Medicaid families. This chart tracks the specific quantitative outcomes of integrating that model. When schools utilize this structured approach, they report an 89% improvement in attendance, an 85% family satisfaction rate, and a 92% reduction in student anxiety. Actual school wellness comes from integrating barrier-free, culturally competent mental health care directly into the environments where students spend their days. That is how we ensure every neurodivergent learner is finally seen, understood, and